Hi everybody, this is Michelle from Virtual Hand Care, your online hand expert. In this video, I am going to show you two really effective ways that you can tape a scar to help improve scar mobility and help improve the tightness perhaps in the tissue that surrounds the scar. So if you have a scar from surgery or perhaps an injury or something like that, you do want to make sure that your scar is completely healed before you put anything on it, of course, or any kind of tape on it. If you have any drainage or anything like that, that means it's not healed and it's not strong enough. So I wouldn't put any kind of a tape that I'm going to show you in this video. I do find that scars can be very limiting to your mobility, especially in the hand and into the wrist. If you have like a wrist fracture, there's not a lot of tissue, of musculature, of fat. We don't have a lot of that in our fingers and our hand and in our arm. And so I find that when we get a scar, sometimes it can really take hold of the structures that are just right underneath that skin, and it really truly can limit our ability. So I'm going to show you two ways to tape, and this way you can tape right over the scar. If your scar is really sensitive and can't take tape applied right on it, I would suggest to try these techniques perhaps to some of the tissue that surrounds the scar, or perhaps some other areas that feel kind of tight. These techniques are really good for that as well. For these two taping techniques, you're going to need some kind of a kinesio tape or a muscle aid tape or K-tape. There's so many different types of tapes out there. I will put a link in the comments below as far as where you can find this particular tape. I'm using muscle aid tape, but any kind of tape should typically do. Now I like to use tape that's not pre-cut because when you're using tape for like a hand or an arm, you really don't need a big piece of tape. So if you do only have the pre-cut strips, which are typically pretty long, you just cut what you need. Now for the first taping technique I'm going to show you, you just need a piece of tape that is about 2 block sizes. So typically on the back of tape, it has blocks. So as you can see here, there's several different blocks, and usually you'll just need like 2 to 2.5 block sizes. So for this taping technique, I'm going to say that I have a scar on the back of my hand here, and I'm going to apply some tape over the top of the hand. So I've already pre-cut one, and I'm going to cut another one. So you want to cut a length of 2 blocks here. Now, I really like to curve the edges of the tape. It just allows it to stay on better. What you're going to do is you're going to tear the backing of the tape. So we're not taking the tape off yet. So we're just tearing it first. So now you have 3 pieces of the paper tape in the back, and when I've done that with both pieces. Now for this first taping technique, what you're going to do is you are actually going to take off first the middle piece of paper. So you've already torn the paper. Now you're going to take that center piece off, and what you're going to do is you're actually going to stick the tape together. So it's going to look like this. You're going to actually make almost like a little tab here, and you're going to pinch that together. You don't need to make the tab too terribly big, but not too short. Okay, so now you've got a nice little tab. And now what you're going to do, so say my scar is right here on my hand, we're going to actually lay the tape over that scar. So we're going to take one side off at a time. Usually what I like to do is have some kind of tension on the scar. So wherever you can either make a fist and apply it, or you can go up into some extension in the fingers and apply it. So for this case, I'm gonna go ahead and make a fist. So I have a little tension already on that scar. Now what I'm gonna do is I'm going to apply that first side. And then I'm gonna go ahead and grab that other side of the tape, and I'm gonna apply just a little bit of stretch. And so for this side, there's a little stretch, and this side, there's a little stretch. As you pull that tape off, you wanna give just a little bit of a stretch. So now you've got this funny little hook. And so what that does is, as you can see, I can now use this tab to work on moving my skin around and doing a little bit of scar and soft tissue mobilization. And I can do this several times a day. So as you can see, I'm getting a nice pull on my skin and my tissue in multiple directions. Now for this second piece of tape, we're gonna do it on this side of the hand. Now do keep in mind and make sure that you do keep your hand free of lotions. So wash really good, because it won't stay on very long if you have a lot of lotion or oils on your hand. For this second taping technique, we're actually going to take off one side of the tape. So the other piece we did the center. This one we're just doing one side. So what we're going to do is we're going to come a little bit more on the side of the hand here, because we're going to give quite a stretch here. Now this would be helpful if you had somebody that could help apply this on, but if you're solo, this will work as well. So the idea of this particular taping technique is you are going to have a stretch in the center. So we tack down that first piece. Second piece is going to come off here. So we're going to take off that second piece. Then we're going to stretch across and give like a 40 to 50% stretch over that tape. Then this side is just tacked down. You have one side with no stretch, a stretch in the center, and no stretch on the other side. So basically what happens when you think of one side, if you think of the two sides with no stretch and stretch in the middle, what happens is you get this nice little lift of that scar in that tissue in the center. And as you can see, you get some nice wrinkles and lift of the skin as well. Now, I do recommend that if you have somebody that can help you apply the tape, with this particular one, it would be a little bit more beneficial actually if you could apply it, the stretch first, then tack the sides down and then get a lift that way. That would be more ideal actually. If nobody else is around and it's just you, then this way will work as well. Do make sure that you wash your hands and keep your hands free of oils or lotions or paraffin when you are applying tape onto your hand, because the tape won't stick very long. And you can do these two taping techniques on your arm, on an elbow scar. You know, I love showing people that have like a distal radius, incision, perhaps something up in your shoulder, even in the leg, anywhere. These two taping techniques are really, really wonderful for lifting that scar, lifting that tissue, and trying to get the structures underneath to move more freely. I hope this video helps you. Do me a favor and like this video, and don't forget to hit that subscribe button. And let me know if taping technique 1 helps you or if taping technique 2 helps you. Come back and comment and let me know which one you went with. Thanks for watching.